Afternoon, everyone. My name's Karen Hausman. I am with the Division of Developmental Disabilities. We are here today. Sukriti, you're showing a Excel spreadsheet, not the slide deck. Thank you. We're here today to have a meeting to discuss the data collection and rate setting for a rate study we are doing for the aged and disabled waiver and the pass waiver. On our agenda today, on the next slide, is just kind of introductions, and then we'll go into more details about what the actual study is. Next slide, please. So as I said, my name's Karen Hausman. I'm a program manager in the Division of Developmental Disabilities. I work with our offices that do contracted case management. This would be the League of Human Dignity, the Area Agency on Aging, DHHS Service Coordination, and the Early Development Network for the Aged and Disabled Waiver and Traumatic Brain Injury Waiver. We also have developmental disability waivers, and I partner with someone closely that works on those. Jeremy, if you're on the call, would you like to introduce yourself?
Hey, good afternoon. Can you hear me?
We can hear you.
All right, good. Sorry, my WebEx is being a little glitchy on my side, so I wanted to make sure first. Jeremy Brunson, I'm one of our deputy directors here at Nebraska Medicaid, so I work within kind of the Medicaid proper division, and we're a sister agency or a sister division, as you know, to our partners in DD. And so I oversee kind of the finance areas, which include all the budgeting, provider screening, enrollment, program integrity, fee-for-service claims processing, and then also that includes our teams that also are responsible for updating the Medicaid fee schedules. And so we'll be involved with our partner division in this process. So look forward to working with you.
Lily will be joining in a minute, so I'm going to go ahead and have Sukriti introduce herself next.
Hi, I'm Sukriti Lamichane. I'm project manager here at DD Division.
Thank you. Charles, were you able to join?
I just got in. I'm Charles Wadey. I'm the data administrator with DD.
Thank you. And Marlinda, are you on the call?
I am. I'm Marty Mead. I am a program manager with Karen, working with the whatever it is we're working with now, whatever she said I'm doing, helping her out.
Thanks, Marty. So Lily is tied up in another meeting, but she is our Deputy Director of Finance within the Division of Developmental Disability, and her and Jeremy work closely together, especially on this project. So we'll go ahead and move on to our introductions for the Optimist team.
Thanks, Karen. I'm Martin McNamara. I am a senior manager with CBiz Optimus. We will be we are the contracted organization setting the rates for this project. So we will be working on developing the rate models in partnership with Myers and Stauffer, who will be handling the cost survey process. I have set rates similar to this before in Nebraska, in fact, with the DD program. So I may know some of you all already based off that. Our full team wasn't able to make it today, but I think we do have Tomas Abrate with us. Tomas, would you like to introduce yourself?
Hi, everyone. This is Tomas Abrate. I'm a manager here at Optimus. Been working for several years supporting Martin's work. I also see some familiar faces on, so it is very good to see those of you I do know. I'm looking forward to getting to know those of you I do not.
And then we have a few other members of our team. Max Breitweiser, he's a consultant. Megan Frenzen, subject matter expert, and Ainsley Ramsey, a project and actuarial support. And they were not able to make it today, but I'm sure they will be on future meetings. with that, the Myers and Stauffer team.
Hi, everyone. Thank you, Martin. My name is Krista Stefani, and I am with Myers and Stauffer. I have over 18 years of experience in rate setting and cost reporting in various services, mostly nursing facilities and with waiver services, both in the aged and disabled arena and the developmental disabilities services. We will be doing a lot of the cost collection and developing a cost survey to provide Martin and his team with information to set rates. Also on our team, she is here, but I'll just go ahead and introduce her. Leslie Behrens is one of our senior managers with Myers and Stauffer, and she has extensive experience also with rate setting and cost collection for waiver services. We are happy to be working with all of you, so thank you for joining us today.
Thank you. And I did see Lily was able to join. Lily, would you like to introduce yourself?
Yes, I apologize. I was late to the party. Again, I was held up by a provider call, so I apologize. Yeah, so my name is Lily Kathe. I am the Deputy Director of Finance and Operations here at Developmental Disabilities Division. I work very closely with Karen and Charles and other DD personnel. I have 16 years of experience in finance, accounting, and operations, and it's actually been my second month here. So I'm so happy to be here, and I'm happy to be a part of this process. Thank you.
Thank you, Lily.
Of
I'm
course.
going to hand it over to Martin for the remainder of the meeting, and then as needed, I will jump in and help.
Thanks, Karen. And before we get into the information, is the meeting being recorded? I'm not seeing an indicator of that. Oh, yes, there it is. Top
Yep.
right corner. Okay. Just very small on my screen. Thank you.
Thank you. Yes. So it's good to know for the audience as well. Yes. We are recording this meeting.
And I'm actually going to turn it over to Krista from Myers and Stauffer to talk through the cost survey process.
All right, thank you, Martin. As just mentioned moments ago, Myers and Stauffer will be taking the lead on collecting the cost data related to this process. And so I'm going to walk through the steps that we usually take when we develop a cost survey for waiver services. As you can see on your screen, we have about 5 steps that we perform. First is the pre-design review, and then we evaluate rate design options, which I believe Martin's team will be doing a lot of that work, but that is part of the process that we take. Also, we will collect data. We'll do some validation and analyze the data that we receive to make sure that we can validate it and that the information looks reasonable. And then we will pass on information for the rate development. So next slide, please. During our pre-design review process, that's where we start looking into what services are we going to be collecting information on in the cost survey. Included with that review, we identify the exact service. We take a look at the service definitions that are outlined in the waiver, and we also reach out to the policy team and the provider community to make sure that we are all on the same page as far as how those services are delivered. Sometimes there are little nuances in the actual service delivery that are not outlined within the waivers that we would like to collect information on so that rates can be set in an adequate manner. Also related to our pre-design review is we collect information on the direct service provider qualifications. We look at the waivers and the associated regulations that outline what are the requirements for that direct service provider. Do they need to have a certain education level, prior experience in providing a service? And that way we can identify and set rates that would allow for an appropriate wage to be paid for that position. And also today is, I believe, the first meeting in this project, but engaging the stakeholders, you are very important to the success of this project. For the cost surveys, encouraging everybody that is in your industry to provide us with information so we know what it costs to provide the service. Without that information, it is hard to set rates and provide Martin and his team with adequate cost information so that rates could be built to cover the cost of providing the service. So we do encourage your participation in these meetings as well as others, and also getting the word out throughout the industry to really cheer us on and help us have success in this process. Next slide, please. It might seem a little bit backwards, but prior to developing a cost survey, we also like to look at what our rate design options are. And Martin will step through that process here in just a few slides. But we like to have an idea of how the rates are going to be established so that we can make sure that we collect adequate information in the cost survey. We will be collecting information, as mentioned before, related to your direct service provider, employee benefits, your program related costs. So those are the costs that are not necessarily incurred to provide the bill, or excuse me, by the person providing the service directly with your participant, but they're required in program for you to have a successful program and to deliver that service, as well as administrative and general expenses. We'll also look at other information that is not cost data for any services that are provided in a group setting. We will collect information on staffing ratios. We'll also collect information on productivity levels. We understand that the direct support and the direct service providers have non-billable time associated with providing the service, such as documenting care plans or what happened on that day, training requirements. Those are not necessarily billable increments, but they are part and integral to providing the service. So we will collect related information on the cost survey for those aspects. And again, although we may not have the specific rate methodology built out, we do like to have an idea of the general rate structure so that we can collect that information. Also, we collect information on potential data sources that we could use to confirm and validate information. We will also go out and look at Bureau of Labor statistics, and I believe Martin will touch on this later as well, but we like to corroborate the information that we are collecting within the cost survey for the direct support professional with nationally public information, such as the Bureau of Labor statistic for a wage that is similar to providing services for that, like, for example, chore or homemaker. We like to look and make sure that we can validate the data that we are receiving. We also look at other states and surrounding state, or maybe other information that Nebraska collects related to services for this waiver, or other similar services provided through other venues, such as other waivers or through the Medicaid program, and just make sure that the data is consistent through all service delivery. Next slide, please. Although this slide is short, there is quite a process in going and collecting the data through the cost survey. So one of the steps that we are currently taking is to design a cost survey to meet the needs of service delivery in Nebraska. When we design cost surveys, they are unique to each program. We don't have a standardized form such as like a Medicare cost report form for hospitals or nursing facilities. We do realize that service delivery and service definitions vary from state to state and even program by program. So we take a look at all the information I've covered so far and implement that into the cost survey so we can make sure to fit the needs for Nebraska. Once the cost survey is designed, we will conduct training for all of the providers on how to complete the cost survey. And generally that training will be a live webinar that is recorded, so it will be available for on-demand viewing in the future. But we will generally walk through each schedule of the cost survey, provide instructions on how to complete each schedule within the cost survey, and also answer any questions. Some other things that we do as well for the training is we might have a follow-up frequently asked questions or a Q&A session a couple weeks after the initial presentation to allow time for the providers to go in, look at the survey, review the training, and then come back with any questions of like, oh, I'm still unclear on this aspect. Can you walk through this again? And we're more than happy to do that. Next slide, please. Also related to training is we will maintain a frequently asked questions document and provide direct support and access to our staff as the providers are completing the survey. We'll update the frequently asked questions document as we receive questions. It won't be a live update. It will likely be a periodic update based on the questions we receive. But in general, in our experience, if there's a question from one provider, there's probably that similar question from another provider. So we do provide access on, or those questions on the FAQ document. So if we are not available to answer your question immediately, there may be a similar question addressed on that document. Also, we will establish a standard, we'll have to work out the ins and outs, but we will provide access via phone and through email for you to ask questions directly of our staff as you're completing the cost survey. And again, as providers are filling out the cost survey, we will be busy collecting other information, as I mentioned before, that's nationally and publicly available to help us with our validation process. Next slide, please. Once we receive all of the cost survey data and they are submitted to us, we will validate the data. We'll look for just general completion, make sure that all related schedules and information is complete. We also confirm the total expenses to any supporting accounting records in general. And then we also perform other various analytical procedures on the data just to help validate the accuracy of whatever information is submitted to us. We also will take all of the data and compile it into a document that will compare and show what is happening industry-wide with between all providers, and we'll do an analysis of all providers to look for outliers. During that process, we may be reaching out to providers for clarification or if we have questions on the information that is submitted, just to ensure what cost information we do have is accurate. Next slide, please. Once we've been able to verify outliers and we've compiled all of the information, we will aggregate all of the information in a meaningful way that will help with Martin and his team's process of calculating rates. So then it transfers from our team over to the Optimus team for their work. So with that, I will transfer this presentation back to Martin.
Thanks, Krista. So to give you an overview of the rate development process, these are the components that are included. And the first, we're going to talk about general rate considerations, how we set rates. Then we'll get into hourly wages for DSPs, those direct support professionals. Then employee-related expenses, staff availability, program support, administration, staffing per unit and staffing ratios, and then we'll give you an example of the rate structure. So on the next slide, our general rate considerations. Our objective when setting rates is to match payment to risk. And generally that risk is associated with financial risk in terms of how much it actually costs to provide the service. And there are 4 different components that we consider as part of that. The first is program design. So what does the overall program look like and how does that influence the cost to provide services? The population being served, which of course has an impact on the cost to provide the service. And then the covered benefit, what the actual service is, And then finally, the service delivery networks, which are the networks of providers that actually provide the service. We have to take that into account in order to get a good estimate for the cost of the service. And if we could go back to the last slide just for a second, there are on the right there a few steps that we go through in the process to make sure that we are accounting for those things. The first is collecting base data, which is what Krista talked through there. And that is going to form the basis for the rates. But once we've collected that data, we are not done yet. The next step is looking at program changes. How does the future program look like compared to the time period when the base data changed? Are there any service definition changes or other changes that might influence those 4 determinants of risk? And then finally, there is trend, which just takes into account that when the time period that the data was collected for is not the future time period. There are changes in cost over time just inherent in the system. And that's true of all things, but healthcare trends have been different than overall trends recently. And that's where we'll take into account things like changes to wages that have happened and that type of thing. So now we can move on to the next slide. So our first component of the rate buildup is the hourly wage for the DSP. And this applies for most services. It might be swapped out for a wage for a non-DSP worker in some certain services, but generally it's the wage of the DSP. The data sources for this, we will be looking at Bureau of Labor Statistics wage data, as well as data from the providers, you all. We want to use both of those components to provide the actual experience from you all, as well as some comparison points to the overall labor market based on the Bureau of Labor Statistics information. We do that. We do trend that data as appropriate. And then if there are changes that might impact this, such as minimum wage changes or other things that might affect the DSP wages, we'll take those into account. And we will be considering the recent wage changes that we understand are going on in the market. So the next component is the employee-related expenses. So this is all the non-wage costs associated with employees, such as FICA and medical insurance. For data sources on this, we will be looking at data from the providers, as well as similar models in other states. And this is applied to the rate as a percent of wages. So throughout this process, you're going to see that this is built up off of the DSP wages. So things will scale with the wages as those are adjusted. Next component, we have staff availability. So this is intended to account for time that is required to provide the service, but that is not that direct service time. And just quick question from the chat. Do you consider other entry-level jobs, other industries that compete for DSPs? Yes, that's going to be something we will look at. So that is something we are keeping in mind, that there are other jobs out there that do compete. Although not in the same industry, they do compete for the same labor market. So moving back to staff availability, the data sources for this are the data from providers and then similar models in other states. So what we're looking to capture here is things like vacation hours and sick time, and then also things like training time, meetings, whether for service planning or employer time where you need to do employee evaluations or that type of thing. we want to take that into account because we understand that those are required to, get the DSP on to the service, even if they aren't actually performing the service during that time. So this is intended to take all of that into account. And then there's a question from the chat. Do you account for the cost of turnover? That is something that we would consider in staff availability. One of the components is training there. So turnover can definitely affect that. So that is something we will be considering as part of the training component of the staff availability. The next component is program support, which is the non-DSP service-specific component of the rates, such as supervisors or clinical support. So data sources for this, it's going to be data from you all, as well as similar models from other states and the service definitions. This is also applied as a percent of wages. And then just quick question from the chat. Travel time is especially important in rural areas of Nebraska. And yes, that is definitely true. So as part of the staff availability, travel time would also be included there. And then there is a component for mileage added later in the rates. So both of those are accounted for. And we will be looking at rural versus urban differences as part of that as well. So the next component is administration. So this accounts for the general business supports that are necessary for providing services, but are not necessarily service related. They're the general costs of administrating a business that are not necessarily related to whatever industry the business might be in. So these the data sources for this component are going to be data from you all, as well as similar models from other states. And it is applied as a percentage of the rate. This is the one that is a little bit different. It is applied as a percentage of the rate instead of a percentage of the wages, just because this is really the final component. So we want to say if there is a 6% administration or a 4% administration, whatever it ends up being, that is a percentage of the final rate rather than the wages. And there's a question in the chat: when comparing to other states, will you be looking at states with the same population numbers, urban versus rural? And we will match that up as best we can, trying to compare states that have similar urban versus rural demographics and so forth, and also where other states have urban and rural rates, using those as part of the comparison points as well. The next component is the staffing per unit or staffing ratios. So what this does is it takes the number of DSP hours and matches those to the service unit. So everything up to this point has been built off one DSP hour. This is where it can be adjusted to instead account for a 15-minute unit, a daily unit, or a half-day unit, whatever is appropriate for that service, as well as if there are cases where the service is not one-to-one, not one staff per client. If it's instead, say, one staff for every two clients or two staff for every one client, that's where we would account for that, or this component is where we would account for that as well. So the data sources we look at here are data from providers, similar models in other states, and then the service definitions where they have a requirement on either staffing per unit or staffing ratios. And this is applied as a multiplier to other components. And then on the next slide, we have an example of all this. So this builds up from a sample wage up to up through the different components. This service or these services, example services, had a mileage component that's included here. That wasn't called out in the specific slides above, but that is something that we include where it's appropriate for the service. But you can see the other components applied here. So it builds up from that base wage, adding in ERE, the availability factor, arriving at an adjusted wage based on all that. Then it adds in the mileage, program support, administration, and gets to a final total per staff hour, and then adjusts for the number of hours. So for the first example, that's an example daily service. So that would be something where you have 7 hours of staff time for every daily unit there. And then the second example is a straight 1-to-1 hourly service. So that just has a 1.0 for the hours. So looking forward to next steps, Myers and Stauffer will be developing the provider cost survey and then collecting this cost survey data. We will be collecting provider feedback throughout the process, in addition to just the survey data. And then once we have the cost survey data, we will be developing the rate models that will implement that data and translate it into a rate. So I know we've had a few questions so far, but are there any other questions that we can address at this time?
A question. When you look at pass, those are fairly independent, or at least Nebraska has a lot of independent pass providers that don't include costs for ERE
Sure.
benefits of any kind. Is that something that can be considered for folks who would like to make this more of a career and not just a part-time position?
Yes, so we will be considering the differences between agency and independent providers. We understand that there are different costs that apply to each of them and that they need to be considered separately. So we are expecting that we will have similar but different rate models between the two of them.
So you're thinking that possibly the independent providers would be, that their pay would include enough so that they could purchase their own health insurance or et cetera?
Where the wages need to be adjusted for that type of thing, yes, that is what we are expecting. What we typically see is that the total rate for the agency does include components for things like ERE, and then the independent provider rate needs to be adjusted to include some of those components, not necessarily all, because not all those costs apply. But that is something that we will be considering, yes.
Okay, that's good. Thank you.
Okay.
But before we go too far in the other questions, I just wanted to add that we're hiring the vendor to study our rates and provide recommendations. Their outcome is to provide a report with the recommendations, and then the state takes back that information, and then we look at what we can apply. So I don't want to overpromise that all these changes are going to be incorporated, but I anticipate they will definitely be put into the recommendation, and I just wanted to share that. Thank you.
All right. The timeframes for the survey and the development of the rate. So we are contractually obligated to have the survey information completed by, I think it's early June. So we will be getting that survey out sometime in May, and we will be doing our best to provide you all adequate time to complete the survey. The rate development process is extended after that. We'll be discussing further when some touch points with you all will be, but we'll need to go back and talk with the state about that before we make any promises there. The weekend and evening differentials on rates. So we typically haven't set rates with weekend and evening differentials, but if that's something that would be helpful and more accurately reflect costs, please feel free to reach out to me with an email. I think you all have my email address in the initial notice for this meeting. So if you can provide more information about what the cost differences there are, that is something we can take into consideration. With regard to transportation, will rates be looked at for both HHS contracts and NEMT Medicaid transportation rates? This rate study does not include NEMT, so that is not something that we will be considering. It's only the waiver services for AD and TBI, and then also the pass rates. So we don't have, we will not be setting anything with regard to the NEMT rates. Will the overtime rate be considered? That is something that we'll be looking at in an ideal model. Overtime would not be included. You'd have adequate staffing, but we understand that the reality does not always reflect that. So that is something that we would expect to be reported in the cost survey and that we would look at as part of the rates. So how does the recent legislation that allows for 15% provider rate increase factor into this? Could the study end with a higher than 15% increase? So I can't speak to where the study will end up. As Karen said, we're just providing a recommendation to the state, at which point they have to take it into consideration like legislative things like legislative funding. Karen, is there anything more you want to say about that?
So the 15% rate increase was due to the public health emergency and some additional funds we had available to us through one of the rescue acts. I apologize, I don't have the name of it memorized. And that 15% rate increase does only cover January 1st through June 30th. When you are providing your reports to Optimus, I anticipate that they're going to have to account for the fact that you would get this 15% rate increase in some manner. But since those payments are coming a little bit later, the data you have may not reflect those 15% rate increases yet.
Okay, thanks, Karen. So is going with a flat rate for all providers like the Veterans Administration moved to a couple of years ago be considered? So what's the what the result of the rate study will be a fee schedule, that a recommendation that we will be providing to the state. So it will be the same rate for similarly situated providers in terms of if we do break out urban and rural, there may be separate rates for urban and rural, but we are expecting to set rates specific to services. So for a given service, for a given urban versus rural, there would be one rate. For assisted living, who will get the survey? Will you use ratios to account for assisted livings tied to nursing versus standalone? That is a good question. That is something that we should include in the cost survey to ask about. What we typically see in rates for things like assisted living is there is a bed size component. So that might also, we might look at including nursing facility as part of that bed count, or somehow adjusting for that. So that's a good question, something that we will ask in the survey. We also expect to send out the survey to all providers. At least agency providers. We're looking at how independent providers can be surveyed in this manner, or if there need to be adjustments for that. Who will be sending the survey to the providers? I am not sure. We've worked out that process. I expect it to come from either the state or Myers and Stauffer. Likely the state through a mailing list with Myers and Stauffer contact on there. Where will the list of providers come from? So that we are using a list of providers from the state. Karen, is there anything more to say about that, or?
So we are providers enrolled in Maximus, and then they have information in a electronic system that we have. It's called InFocus. So we pulled the list of emails that are stored in InFocus to create the provider list to notify most of the people on here. We've also notified the provider organizations as well. And then we had to pull the assisted living contacts in another manner, but we've created what we call listservs based off of that data. So there may be email addresses who unsubscribed from that, but we're doing our best to account for the current providers to ensure they have the opportunity to participate.
Okay, thanks for that, Karen. Will you ask independent providers to participate in the cost survey in some manner? We are evaluating what we can ask of independent providers. There have been a few that have already volunteered to give input. So we will be likely asking some questions, perhaps not to the same depth as agency providers, but there likely will be some form of survey. Will there be consideration for assisted living facilities that specialize in Alzheimer's and dementia? Considering our staff to resident ratio being much higher than most assisted living facilities? That is a good question. We are looking at ways that we might explore different levels of intensity to the rates. So that might be one that we could look at. Kent, if you have more information about that, I would appreciate an email about that. So the legislation only referred to the emergency temporary rate increase and is not a permanent increase. Is that the case, Karen?
Yes, that is correct. If I am thinking of the same thing that Sean's referencing, there was quite a few bills that were flying around.
Okay, thank you. Will this survey also account for those assisted living facilities that provide memory care or that have a memory care unit, as the costs are typically significantly higher than general assisted living care? Again, another good question. So if there are specific things that or specific conditions that a client might have that would drive up costs, that is something that we would appreciate your input on. That is something that we can include a question on in the cost survey, and that can help us identify cost drivers within the system to appropriately address those in the rates we recommend. The majority of providers are independent providers, especially in PAS. There are no agencies serving PAS clients. So yes, that's why we are considering what a cost survey might look like for an independent provider. They typically do not have the same reporting capabilities that an agency might, which is why we are evaluating what that should look like. And that's the last question I'm seeing in the chat. Here we are. Will the study also look at access to assisted living for Medicaid waiver across the state and identify geographic areas where access may be limited? I don't think that evaluating access itself is within the scope of our contract, but where that affects costs, that is, we could take input on that, but given that it's not in the scope of our contract, I cannot really promise anything there. So I want to give it another minute to see if there are any other questions. My email was in the notice for the meeting. So I've received emails from a few of you already. If you have any other questions or comments you want to give that come up after this, we'd be happy to receive those and take those into consideration. What is the time frame for the implementation of the result of the rate survey? Karen or someone from the state, do you want to comment on that?
There's a lot of dependencies on this. I'm sorry, Sukriti, did you want to respond?
No, you can go ahead.
Okay, so once we receive the recommendations, the state has to review it as a whole to figure out where to go. And if the survey comes back and says there needs to be significant rate increases, then we have to go to the legislator and legislation and get appropriations. So it's hard for me to give an exact time frame of what the implementation would look like. And Lily, I don't know if there was anything more you have to say about that.
Yeah, the only thing I'd like to add is if the process is completed in a timely fashion and it's determined that the appropriations have already happened, we can always submit what we call a mid-biennium, which is a report that we submit to the legislator to kind of put into effect any changes that might have happened before the next biennium happens. So the timing is key here. Depending on when everything happens, we can definitely effect those changes as necessary. That's all.
Okay, I'm not seeing any questions after that. So we do plan to keep you informed on the process following this. So be on the lookout for future communications through the state. There is, let's see, a question in the chat. On assisted living surveys, you may want to include if the facility has a private pay component or requirement before accepting waiver payment. Okay, that is a good point that we can take into part of the rate study. There is, as part of this, we do want to consider what other funding sources a provider has that might be covering some of the costs. There are certain costs that CMS, the Centers for Medicaid and Medicare Services, they say that they cannot be paid for as part of rates like this. That's also part of the consideration. So there are non-allowable costs as well, and then other funding sources that on the funding side that need to be considered. So that is a good point and something we will take into account. And we do have a few more minutes, so I'm going to give it another minute or so before we wrap up the meeting, just to see if there are any other questions. As I said before, if something else comes up and you want to give a comment or a question, my email is included in the notice for this meeting. What are some of the non-billable items from CMS? Can you give examples? So one of the largest components is room and board. That is not typically allowable under CMS regulations, and there are other components. We'll give you more information about what those include specifically as the process goes on. Will the cost survey be sent to all licensed assisted living, or only those who are identified as waiver? So, Karen, can you speak to the scope of this?
So we are only looking at those assisted livings that serve the waiver, and my intention was to only include ones that are currently waiver providers in the cost study.
Okay. All right. Then I think we can wrap up. Are there any final comments you want to give, Karen, or anyone else from the state?
I wanted to thank everyone for taking the time out of your busy day where you're responsible for serving the people that we're authorizing services for. So thank you so much for taking time to come and for your interest in participating in this survey so that we can have the best information available as we move forward with figuring out how to improve our provider network and account for the costs that may not be accounted for currently. So Lily or Jeremy, did you have anything else you wanted to say?
No, just to thank everyone again. We will work through this, we'll get it. And yeah, thank you for your time.
And nothing further from me. Thank you. And I would echo Karen's comments. Appreciate all the work that you do and taking extra time out of your day to meet with us on this important topic.
All right. Well, thank you very much, everyone. We will be reaching out with more communication in the future, so be on the lookout.